Performing CPR on a newborn can be daunting, but it's essential to know these life-saving steps. Here's what you need to do. First, if the baby is not breathing or has a heart rate below 60 bpm, it's time to act. Place the baby on a flat, firm surface. Check for breathing and heart rate through the umbilical cord, brachial artery, or with a stethoscope. If there's no breathing or just weak gasping, gently stimulate the baby by rubbing their back or flicking the sole of their foot. Next, open the airway. Position the baby's head neutrally with a slight tilt. Clear any obstructions with a suction bulb or catheter. Begin positive pressure ventilation with a bag mask device at 40 to 60 breaths per minute. If there's no improvement, recheck the airway and reposition as needed. Now check the heart rate. If it's below 100 bpm, continue ventilation. If it's below 60 bpm, despite 30 seconds of effective ventilation, start chest compressions. Use the two-thumb encircling technique. Place both thumbs on the lower third of the sternum, just below the nipple line, and wrap your hands around the baby's chest. Remember the 1 compression to ventilation ratio, 3 compressions for every breath. Aim for a compression depth of about 1/3 of the chest diameter, roughly 1.5 inches. Your rate should be 120 events per minute, 90 compressions and 30 breaths. Every 30 seconds, reassess. If the heart rate rises above 60 bpm, continue ventilation without compressions. If it remains below 60 bpm, keep going with CPR and consider advanced interventions like epinephrine or intubation. Stop CPR when the heart rate stabilizes above 60 bpm and spontaneous breathing returns, or after 10 minutes if there's no response following medical guidance. Stay informed and prepared. These steps can save lives.